we are going to present to you a method of understanding thermal imaging a little bit better and clearer. Our devices that we use are cleared by the FDA. There's absolutely no radiation and no contact with our machines. This is a way you could actually set it up in your office to make it easy for you and patients to utilize. The images will be in no particular order of importance. In this image you can see on the left hand side the patient presented with left-sided masseter inflammation, and after some work you can see how it improved. This is an interesting case. You can see the mouth is full of oral bacteria that's creating inflammation and a lymphatic drainage down the right side, and you follow that down to the above the sternum, and you can trace the inflammation, which we assume is oral bacteria, right down into the right nipple. And you can see the green arrows pointing to that right there. Okay, in this picture, the best way to analyze this image so you can understand what's happening is to start at the bottom and work your way backwards. So you can see in the right breast the red area over there, and you can see the next picture up from there is a little bit less red, up from that a lot less red, and at the top there is no red. Obviously the point we want to find these patients is in its earliest phases, and as you can see this patient did not consult with the breast surgeon like it was recommended and continued on trying to change some lifestyle things in her life. And as things progressed, I don't think the reality of having breast cancer ever set in properly, and she continued to progress until she passed away less than a year from our initial findings at the top. In this image we can see the upper left hand corner on March 13th, 2012. It was in 2009 that this patient actually had a lumpectomy for her cancer in her left breast, which had returned by this date that we're looking at. And as you can see, by the next time we took the images, she had decided that she was not willing to go through the same type of treatment that she had prior, and she was aggravated by the American medical system, according to her own words. So she went on a very strict alkaline diet. She went to Panama for treatment. She used infrared saunas. She bought Mountain House to relax. So she did everything that she thought she was doing right to correct her situation. And in August, you can actually see that it looks like it actually subsided a little bit. The delta T went down a little as well. But soon after returned, and returned again in February of 2013. And then she lost contact with us for a year and came back in January of 2014. And as you can see, the left breast tissue had deteriorated quite a bit by that point. And then it wasn't too much later, it was May, that she had passed away after that. So the study shows us the progression that happens, and interestingly that the progression isn't always a linear effect. But more importantly, what it's taught us is that patients should monitor their conditions at least every 3 months, if not monthly, when they have cancer. That's if they're trying to do a more natural treatment, or I suppose any treatment for that matter. But at this point, we would have known she was deteriorating a lot quicker, and we could have hopefully persuaded her a little bit better to go for the traditional treatment for a mastectomy at that point. Patients choose their own care at times, and there's nothing we can do about it. This would not have been my recommendation for this patient. However, as you can see, it was her choice, and it gives us a good outline, teaches us a lot of good information about thermal imaging that we can use on other patients and other assessments. It's not exactly what traditionally we've been taught in thermal imaging education. However, it certainly serves its point. Many doctors believe that the bras restrict lymphatic fluid through the body. This is an image of a woman who had acclimated for approximately 15 minutes prior to taking this picture. You can see the red marks of her bra, which are areas of inflammation or heat right where the bra was. And then above that, between the U portion of the upper bra, you can see a pooling of interstitial fluid that is showing up in this image. This is a fantastic example of how a chiropractic office might use thermal imaging. The boy in the left picture is actually the same boy as the one in the right. In the left you can see his posture is way off and he's got thermal abnormalities. The picture in the right shows that this is improved, and it's a great patient education tool. The science of thermography is very important to understand. What you're seeing here is a series of images as the camera warms up. So it's very important to have proper protocols for acclimation of both the patient and the camera itself, as you can see in this image. There are many images that we can take with thermal imaging. It measures the skin surface temperature, so as in this case we can see the heat in the upper left portion of the testes. This is most likely a varicocele. However, testicular cancer can also be seen. This woman had her baby checked in the inverted position, and you can see by the purple that the baby had asymmetries thermally. Thermal imaging in this case was used to assess the effects of the needling in acupuncture. As you can see, the temperature difference from side to side in the upper left-hand corner was far greater than that in the lower right. This patient presented to my office with low back pain and radiating numbness into the left leg. You can see the dermatomal pathways displayed as cold in the sympathetic response that was elicited by the nerve root compression in the lower spine. Here's another example how a physical therapist or chiropractor might use thermal imaging. You can see the inflammation present on the left-hand side, and after a course of treatment you can see how it's improved significantly as inflammation had subsided. This is a great way to monitor patients' results. As you can see in the picture on the left-hand side, the right breast has a closed vascular pattern that is not seen in the opposite side. This shows the patient that their lifestyle changes are working. Proper education of thermographic science, again, is important. The wall in this image is the same temperature, however, it projects differently. And as you can see, it shows the temperature from 20.3 to 21.6 degrees. Okay, here we are with the Professional Academy of Clinical Thermology with another case study. This study just came into us today. And as you can see here in the left breast, looking at the grayscale imaging, there's a vascular network present that is highly abnormal and highly indicative of breast cancer. Looking over at the color imaging, you can see the same pattern but in red and yellow radiating into the mediastinal area. And the delta T measured here was 5.68 degrees, which is one of the highest we see with breast cancer. The patient was 61 years old, and the issue being that she is involved with alternative health care highly, to the point where she would not go for a mammogram. She finally went for a thermography test, and this is what she had. So we would have preferred that she would have done this from a much younger age, and we could have found this far sooner than we did here. So lesson be learned to everybody out there that, you know, denial isn't the way to go, and ignoring is not the way to go either. If we are, for some reason, not going to support the mammography industry due to radiation or other concerns, certainly we need to be doing something else. And this is one of those tests that is highly recommended.